Last week, we dove into the world of HPV and speculum exams. Dr. Diane Harper is an outspoken advocate for women's health and comfort within medicine. A big focus is reducing the industry's use of the speculum. It's a device that widens the vagina for necessary exams. However, it can also be a main source of discomfort, anxiety, and pain. Despite these negative experiences, Harper says this tool that's been around for centuries has never undergone a major update.
It's an instrument that has been used by men in the field caring for women with never a thought that this would be potentially abusive to her, that it would be painful to her, that there would be better ways of doing this. And it became established as that's just the way we do it. It just causes me to cringe when I hear an older person say, well, the woman just has to suffer. She just has to do it. That's what we do for medical exams. And I'm like, no, she doesn't. If you are a forward-thinking, curious person to wonder about how do you make it better, you would think about that. I can tell you that the people who make house paint don't stop with that very first house paint they made in the 1800s. They have continually evolved that because their customers have demanded it and they've put it forward. So we as women have the right to demand that better tests become developed and that better tests are made available for us.
Harper is a professor in the Departments of Family Medicine and Obstetrics and Gynecology at the University of Michigan. She says that with the approval of the self-sampling tests that we discussed last week, there's no need to use a speculum unless a woman has concerns or symptoms she's noticed. And despite the American medical community's resistance to this change, Harper believes we should be using the data and evidence to guide current practices.
I think that you get entrenched in ways of thinking about things that have been done forever. And sometimes it's hard to give them up because you think, well, they've been done forever and we're okay. The problem with that is that you don't know all the cancers that you're missing because of the way you're currently doing it. I would posit that we do know that of the women who get cervical cancer in the United States, half of them haven't come in for screening. That says there's something wrong with our screening method. These women are telling us in interviews that they were sexually assaulted, that they feel uncomfortable in the office, that the physician made some kind of weird green comment at some point that has now totally scared them away from ever revealing a nakedness of them that's very personal and that women do not like to have invaded.
A 2022 paper in JAMA Network Open shows that the number of women without up-to-date screening has significantly increased. Unfortunately, the numbers are even worse for women with a physical disability. Harper recently worked on a small study published in JAMA Network Open that evaluated the screening disparities faced by disabled women. Interviews with the 56 participants reveal how difficult each step of the process is. For women who use wheelchairs, even entering the office can be a challenge.
And then you're sitting in the room and the doctor says, okay, now we really need to do a cervical cancer screen on you. And the woman's like, well, I need somebody to help get me up on the table. And then you have to know that my pelvis is contracted and my legs, my knees won't go very far apart. And I can't use the speculum in this way. You have to turn me on my side or you have to help hold my leg up. And then I need somebody to come in the room and help me undress. How would you feel if you had to say that to somebody just to get a routine preventive healthcare screen? That doesn't give you a lot of sense of empowerment.
And when the speculum is finally inserted, some of these women fear they'll lose control of their bladder, or the nurse will drop their leg, or just simply feel embarrassment that their experience is different from the other patients.
It could be a scary thing for a woman with a disability to think about how in the world am I going to get the health care I need? Because we know that over 50% of kiddos with spina bifida, over 80% of people with cerebral palsy, and 94% of people with other physical disabilities are sexually active. Okay, sex means that there's an opportunity for skin-to-skin contact, which means there's an opportunity for HPV infection. And if there's an HPV infection, then we can help you by vaccination, but we can also help you by screening in a way that's now more comfortable for you.
Women will have to go back in for a speculum exam if the results come back positive, but Harper estimates that around 90% won't have to go in for a follow-up. She says that though this change will help women, there will need to be a lot of education to clearly identify every step. Some women may hear of self-sampling and think that there's no need to ever go in for a follow-up appointment, which would be extremely harmful to their health if they end up having positive results.
To me, the very most important thing is that women just don't go off by themselves and get an HPV test, that they work with their doctor. Because if it's positive, you have to have a relationship with someone that you trust, that you can talk to about what does it mean? What do I need to do? Tell me about that. Does it hurt? Does it not hurt? Do I need somebody with me? What are you really looking for? And tell me again, because I didn't get it. Like, draw me a picture because I didn't get it. And that part is really, really important.
In fact, Harper says that self-sampling can help create a better patient-doctor relationship.
The advantage of that is that instead of spending time with the woman in the exam room and with my head underneath a sheet and a speculum and getting the specimen to send to the lab, I can instead talk to her face to face about that sample that she's collecting and what those results might mean. And where does that put you in this long spectrum of HPV infection, and then small transformation, and then bigger transformation, and finally cancer, and where do we intervene and what interventions do we have to offer to you? So I think that it offers us an opportunity for communication.
Right now, the FDA has approved these self-administered tests to be used in a medical institution like the doctor's office or lab. But as screening methods continue to evolve, Harper says we may soon be able to use them at home, which would hopefully increase access to this important health information.
We are hoping that, and there are studies ongoing right now, that will allow there to be a home approval for the HPV test, just like we have for colon cancer screening. And then we'll truly be able to make it easy for women to get the screens, and they can either pick them up at the lab and take them home and do it, or potentially have it mailed to their house and then just mail it back. Women need to demand that they know that this works, the data's solid, it's rigorous, and they can do it. They can do it themselves.
You can find more information about Dr. Diane Harper and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.